Welcome to Medverse. Today I will discuss the laboratory testing in typhoid fever. Now, typhoid fever, how will you approach in the case of the typhoid fever? So, before going to the main discussion, you have to know the basic thing in the immunity part. Now, we all know we have two types of the immunity. That is, one type is innate immunity and one type is acquired immunity. That is the innate immunity, two type of immunity. One is innate immunity and one is acquired immunity. One is innate and one is acquired. Innate and acquired immunity. So innate immunity, what is meant by innate immunity? Innate immunity is not specific, and acquired immunity mainly the antibody formation, mainly the antibody formation against a specific antigen. That is, it is specific to a antigen. Now, this is the basic concept. Now, if you imagine a pathogen enter in your body, at the point A. So at the point A, pathogen enter in your body. As we here discussed the laboratory diagnosis of the typhoid fever, we assume that the pathogen is Salmonella typhi. Now, after the pathogen entered in your body at the point B, symptoms started. So pathogen enter in your body at point A and the symptoms started in point B. This time period is called incubation period. We all know the pathogen enter in your body and the first symptom, the time gap is known as the incubation period. And in the case of the typhoid, the incubation period is 14 to 21 days. 14 to 20, 21. 14 to 21 days. Now, during this incubation period, the innate immunity deals with the pathogen in our body. So, when the pathogen enter in your body, the innate immunity constantly fight against the pathogenesis and dealt with the pathogenesis. When the innate immunity, when the pathogen overtake the innate immunity, then the symptoms started and the infection occur in your body. So during this period, the innate immunity fight. So what are the role in the innate immunity? Like if you imagine, if we had discussed the typhoid, the innate immunity for typhoid is the gastric pH. Gastric pH dealt with the bacterium and the lymph node and the complement system. These all are the part of the innate immunity. They are non-specific and they fight their role within the incubation period. And now, when the symptoms have started already, then your role of acquired immunity comes. So this is the main concept. Now, at the point B, the symptoms started, and after 5 to 7 days, this time period is constant. 5 to 7 days time period is constant. 5 to 7 days at the point C, the antibody formation started. Antibody form. So at the point C, the antibody formation started, and B to C, this time period, B to C time period is constant, and this time period is 5 to 7 days. So A to B time period is called the incubation period. It is varies. It is different in different bacterium and different in different pathogenesis like bacterium, fungus. But B to C time period is constant for every pathogenesis, and it took 5 to 7 days. So when your symptom started in your body, after 5 to 7 days, your antibody formation occur. This time period is called seroconversion period. So what do you mean by seroconversion period? Seroconversion period means in your body at the point of the B there is only antigen, no antibody. At the point of C, the antibody formation occur. So antigen lead to antibody formation. So at the point of B, if you do any antibody based test, your test will negative. So between B and C, that is, if you do after your symptoms occur within 5 to 7 days, if you do any antibody based test, your test will always be negative. Like the, if you imagine, like the dengue fever come today, and after the 5 days only you can do dengue IgM antibody testing. Before 5 days, if you done dengue IgM antibody, it will always become negative. So before 5 days, that is within 5 days of the fever, you will have to do NS1 and NS1 antigen for the dengue fever, that is antigen based testing. So this time period, 5 to 7 days time period, is constant. That is, you after the symptom occur in your body, after 5 to 7 days, the antibody formation started. So this period is called the seroconversion period, and also called as the window period for the antibody based testing. Why? Because the during this period, if you do any antibody based testing to diagnose the cases, your test will always be negative, because antibody doesn't form in this period. So this time period is called the window period for the antibody based testing, and also known as the seroconversion period, because in your body there was antigen, no antibody. After 5 to 7 days, the serum is positive for the antibody. So serum is convert from antigen positive for, initially positive for antigen test based testing, become the positive for antibody based testing. So seroconversion occur. So this time period is very important. Now, what are the natural history of the typhoid fever? Now we all know in our basic concept that typhoid fever is caused by Salmonella typhi, Salmonella paratyphi A and paratyphi B. Now nowadays the typhoid is a mixed infection. That is, the only typhoid Salmonella typhi, or only Salmonella typhi A, paratyphi A, or only Salmonella paratyphi B is very rare. Nowadays the mixed infection occur, that is, the mixed infection by the Salmonella typhi, paratyphi A and paratyphi B occur. Now the route of transmission of the typhoid is the fecal-oral route. The source is from the sewage or the drainage, and 10 to the power 5, the infective dose is 10 to the power 5. Now the imagine the pathogen enter in the body by the fecal-oral route, in goes is to the, so pathogen enter in your body, enter body in body, and goes into the stomach and bypasses the stomach. The stomach acidity does not cause any problem in the case of Salmonella typhi or paratyphi A or paratyphi B, and it goes into the intestine. So it goes into the intestine. Sorry, goes into the intestine. Intestine. Now it goes into the intestine. In intestine, it causes the erosion of the intestinal mucosa and cause mild ulcer. So it causes erosion of the intestinal mucosa and cause mild ulcer, and via this erosion it invades the blood vessel and goes into the bloodstream. So from the intestine it goes into the bloodstream. Goes into the blood, and when it goes into the blood, the symptom of fever started. So as it goes into the blood, the fever started. Now the symptom started at the point, if we imagine it is a point of the A, at the point B, that is, it goes into the intestine and cause mild erosion, and the point C, it goes into the blood and the fever started. So at the point C, the fever started. The first symptom started in your body. Now from our previous concept, we know that from the point C, The antibody formation occur at point D. That is after 5 to 7 days. So after 5 to 7 days, if we imagine that the point C is day 1, at point D after 5 to 7 days, at the point D antibody formation started. Antibody formation occur. So just imagine, if we imagine that in this period, so in this period, that is point C to D, if you want to diagnose the typhoid fever, you can do any antibody based testing, because antibody is not present in that point. So you can do Widal test. So Widal test is negative during the first week of typhoid fever. So at the point C to D, your investigation would be blood culture, because the bacterium is present in the blood and that lead to the fever. So at the first week, so the concept is, in the first week blood culture is the blood culture is your, so at the first week the blood culture is your investigation of choice to diagnose the typhoid fever. The Widal test is negative in this period. Now